Hello guys, my name is Dr. Shailesh Gupta. I'm a laparoscopic, bariatric and robotic surgeon in Max Patpardhan's Delhi. So I welcome you all to Mastering Bailey and Sabiston page by page lecture series. Today I'm going to present fifth lecture, that is blood transfusion. So it is a very important topic because blood transfusion is a common clinical practice done on a daily basis in our daily clinical schedule, and it is not a simple procedure. It can lead to lot of complications including death, and it also has some legal issues, right? It is important to know that about the components of blood, which component to be given when. So I request you to keep focus in this lecture. It is a very important lecture. So as I told in the previous lecture, I have simplified the text of Bailey in this chapter, and I have discussed the figure, table and boxes more objectively, right? So there will be few MCQs, answer of which will be there in this text, and I will also give answer in the post test. So pre-test will tell you about your awareness of the subject and also will keep you interested when the theory comes, right? So please enjoy this lecture. So content of lectures are, we're going to discuss about blood products, indication for blood transfusion, blood grouping and cross matching, complication of blood transfusion, management of coagulopathy and blood substitute, right? So the first topic is history of blood transfusion, right? Blood transfusion has got a very rich history. There were a lot of people, there were a lot of famous personalities, scientists who played an important part in development of a safe blood transfusion, right? So here the question of the pretest is, who is credited with the performing the first successful documented human transfusion in 1818, right? So first transfusion was done around 200 years back. So the choices are Carl Landsteiner, James Blundell, Albert Hussein, Richard Lower. So now the text, so there are some important personalities which played an important role in blood transfusion. See, 1492, Pope Innocent VIII suffered a stroke and received a blood transfusion from three 10-year-old boys. All three boys died, as did the Pope later that year. So this is one of a historical event in the past for blood transfusion. And in 1888, James Blundell performed the first successful documented human transfusion, right? This is very, very important. The first transfusion, successful human transfusion was done in 1818, right? So it was done in a woman suffering from PPH, and she received blood from the husband and survived. See, 1901, Carl Landsteiner discovered the ABO system, right? And in 1939, the rhesus system was identified and recognized as the major cause of transfusion reaction. So 38 years later, RS system was identified. So the answer is James Blundell performed the first successful documented human transfusion in 1818, right? So the next topic is blood products, and these are the MCQs. How is the packed red cell stored to increase shelf life? CPD solution, SAGM solution, saline solution, mannitol solution. So increased shelf life in which is there, right? What is the shelf life of platelet? 2 years, 3 weeks, 5 days and 1 month. Question number 3. What is the primary indication for prothrombin complex concentrate, warfarin reversal in uncontrolled hemorrhage, thrombocytopenia, factor VIII deficiency, none of the above? What is the primary component of cryoprecipitate? Factor 2, factor 9th, factor 8th and fibrinogen, and factor 7th. So this slide tells us about the blood donation safety protocols and rules. So these are as per UK protocol, as the Bailey mentioned more about the UK protocols. So as per our standard book, up to 450 ml of blood can be given 3 times per year, right? That is the collection limit. Now, which infection are tested during transfusion? Hepatitis B, C, HIV-1, 2 and syphilis are tested, and it is also known that for Creutzfeldt-Jakob disease, the blood is leukodepleted, right? Hepatitis B, C, HIV-1, HIV-2 and syphilis are tested, and blood is made leukodepleted to avoid Creutzfeldt-Jakob disease disorder. So obviously blood group is determined for before transfusion. ABO and the RHD blood groups are major group to be identified, and apart from that, other blood group antigen antibody reaction are also tested. So these two are major. Apart from that, irregular red cell antibodies and other antigen antibody reactions are also checked. So I'm going to discuss first about whole blood. So whole blood is very precious, right? So it is rarely available in civilian practice because it has more importance in military practice rather than civilian practice. So what is the advantage over the packed cell? It contains coagulation factor, right? And it is seen that fresh whole blood is more metabolically active than old one, right? Just remember this. So next component is packed red cell, right? Basically these are spun down and concentrated RBCs, and each unit contain 330 ml and the hematocrit value is 50 to 70%. So these are stored in SAGM and CPD at 2 to 6 degrees Celsius, and SAGM is basically stand for saline, adenine, glucose, mannitol, and CPD stand for citrate, phosphate and dextrose, right? So half-life on shelf life in CPD is 2 to 3 weeks, whereas shelf life here is 5 weeks. This is very important. SAGM increase the shelf life of PRBCs, right? And in CPD, shelf life is of 2 to 3 weeks. So the next component is fresh frozen plasma, right? So it is basically a coagulation factor rich component. It is stored at -40 to -50 degrees Celsius, right? And it has a shelf life of 2 years, right? It is a first line therapy for coagulopathic hemorrhage. So any bleeding which is caused by coagulopathy, we should give FFP, right? It is important to know that RH positive FFP can be given to RH negative FFP, but the large volume of FFP may contain few RBCs, right? So this can lead to seroconversion, right? If we are giving RH positive FFP to the RH negative patient, in case of large volume, the FFP might also have RBC, and this RBC, RH positive RBC in RH negative patient can lead to seroconversion, and this will lead to anti-RHD antibody formation in RH negative recipient, right? So in this we should consider RHD immunization. So as such, FFP is not antigenic, right? But if we are going to give in a large volume, it will have some few contaminants in form of RBC. So these RBCs are loaded with the antigen, right? And this, as soon as these RBCs goes into the RH negative person, they will lead to formation of anti-RH antibodies, right? So which can have a problem in a pregnancy. So in this patient, we should consider RHD immunization, right? And it is a first line therapy of coagulopathic hemorrhage, FFP. So what are cryoprecipitate? Cryoprecipitate is supernatant precipitate of FFP. It is rich in factor VIII and fibrinogen, right? It is stored at -30°C, shelf life of 2 years. So now I am going to discuss about the platelets.